Now let's discuss one of the important tasks of the ADC practical exam, which is the amalgam restoration task, right? Which is part of the restorative cluster. Now, a lot of candidates that I see uh, usually have a hard time doing this task, and also it's one of the tasks that very commonly results in the failure in the restoration cluster and unfortunately failure in the entire exam. So I'm going to go through certain important points, certain important tricks for this task for you to be able to cope and understand this task in a bit better way, and certain troubleshooting tips at the end as well, just to give you more clarity on how you can work your way out on having a clinically satisfactory restoration, and also a restoration that fits into the ADC marking rubric, because that's the most important thing. ADC marking rubrics is the most important thing. Any task that you do should be fitting the ADC marking rubric, all right? So let's do that. Okay, now, like I mentioned, it's one of the most commonly failed tasks in the exam. Now, those candidates who are already enrolled in the Academy's course, because we are run a complete online course for the technical component of the exam, we have a demo video in the portal. So for candidates who are enrolled, watch it very carefully. We have demo videos, we have assessment videos. Every step is important, because with this task, especially the amalgam task, even if a single step is missed or done wrongly, all will go wrong. That's something that you need to be very careful. That's why we have such detailed demo and assessment videos, which are quite lengthy, because we don't want you to mess up even a single step, because every step adds to your final success and for the restoration. Okay. Now, the other thing that you need to also understand, that ADC wants clinically acceptable restoration, not aesthetically acceptable restoration. Quite commonly, we see this misconception with candidates is that my restoration doesn't look beautiful, or my restoration is too beautiful, I can't fail this task. That's a complete wrong concept that you have. ADC wants clinically accepted restoration, not aesthetically acceptable restoration. And this holds true for every task of the practical exam, every technical task. There is no criteria in any task marking rubric that the task should be beautiful or aesthetically pleasing. No. If you look for the marking rubrics of all the ADC technical tasks, nowhere it says that your task should be beautiful or your task should be aesthetically pleasing, because that does not matter. It should be clinically acceptable, fitting the marking rubrics that the ADC have created. All right. Realistically speaking, especially with respect to the amalgam task, it does require a practice of at least, which is bare minimum, 15 to 20 times, bare minimum. And the more, the better, because depending on your circumstances, I know candidates doing it 50 times, 100 times. Do it as many times as you want, as long as you're able to achieve the final successful restoration, which will help you pass this task on the day of the exam. The other thing that you need to also remember, the mixing time. Now, the mixing time for the amalgam capsule will vary quite significantly. Sometimes you will see that you mix the same amalgam capsule in the exam, but it tends to set quite fast, or it tends to set quite slowly. You can't change that. You can't do anything about it. You just have to adapt yourself. That's it. So if you're practicing at home, it's setting faster or slowly, or you're doing the task in the exam, it's setting fast or slowly. You can't change it. Just adapt yourself. Okay. Key components to look for, very important key components that decides on a failure or passing this task? Number one, contacts. Your contacts needs to be good. Your cusp position, your tooth restorative junction, very important. Your tooth restorative junction is very important. No gaps, no ditches. Okay. Your mesial ridge height, as the marking rubric says, your mesial marginal ridge height should be equal to the adjacent marginal ridge. Again, very important. Okay. These are the bare minimum that you need to achieve. Once you achieve that, you can expect to pass this task. Of course, anatomy to some extent is also important. You cannot just fill it, right? You need to create some anatomy, but I see candidates emphasizing so much on anatomy and neglecting the other key components, which is the contacts, cusp position, tooth restorative junction, mesial ridge height, marginal ridge height. So just don't rely on anatomy so much. Anatomy to some extent, clinically acceptable, is fine by the ADC examiner. Commonly seen reason which a lot of candidates neglect or take it lightly, excess amalgam on the tooth and the gums. I see a lot of candidates doing the restoration really well, and then we see excess amalgam on the tooth or the gums. Why are you marking yourself down? It's an easy point which is going to mark you down, unnecessarily losing score. Why? Why do you want to do that? Your tooth and your gums should be free of any amalgam debris. And the ADC also provides you alcohol swabs in the exam. Use it after the task. Rub the alcohol swab on your restoration, on the tooth, on the gums. Remove all the debris. Use the triple X range. Wash it off. Don't mark yourself unnecessarily down for points you can easily score. Okay. Troubleshooting. Now, certain things that I want you to discuss in the troubleshooting basically means that how to get things right. Let's say you have very tight contacts initially. Before doing the restoration, you're not able to pass the matrix band. You can always use the largest size of wedge and then place it in the interproximal area, pass your band, remove the wedge, and then reinsert it again. That doesn't work. Use a ball burnisher interproximally between the teeth. Press the ball burnisher in the interproximal area because these are plastic teeth, right? They will move a bit, creating space. Now, let's say you have tight contacts, very tight contacts after you are done the restoration. You're not able to pass your floss. Again, use a very thick wedge, use a ball burnisher, create some space, and then pass the floss. You can even use composite strips to remove excess, right? And your contact will be fine. Now, the other situation that we commonly see, candidates saying that my amalgam set, the amalgam is completely set. I was not able to carve the anatomy. First of all, try to carve your anatomy as soon as possible before the amalgam sets. Now, let's say if that happens to you in the exam, you don't have time to redo the restoration. You don't have time to replace the restoration. Ideally, of course, replace, do the restoration again if time allows, remove the amalgam, wash it, and then do the entire task again if time allows. But let's say no time. If you don't have any time, take the burr in the high-speed handpiece, fix the anatomy and the marginal ridge. There is no harm in using a burr for your restoration. If your amalgam is set, you don't have time to repeat, please don't leave it as it is. Use the high speed, use the burr, any burr you are comfortable with, carve the anatomy. Doesn't make any difference to the examiner. I have heard this many times. Don't touch your burr on the amalgam restoration. Why not? I don't know why people give this ideas. Don't touch. Why you don't touch? Your outcome matters, not how you achieved it. So please, if the amalgam sets, you haven't carved the anatomy, your marginal ridge is higher, you want to adjust the cusp position, you want to adjust the cusp slopes, use the burr, please. Always use the burr if you don't have anything else left, because you want to create a restoration which is satisfactory according to the ADC marking rubrics. They are going to see your task as a whole. They don't care how you created it. So the outcome matters, not how you achieved it. Okay. And once you have used the burr, you can always use the enhanced point that you have to smoothen up the restoration, right? All the burr marks will go. So always try to fit yourself in the way you can. No one is looking inside what you're doing in the mouth. The examiner is not standing on your head. They are just going to take your jaws after the exam for assessment. How you create it, what you do, does not make any difference. The outcome matters. So your thinking should be, I want to achieve the outcome. If you are able to achieve it following stepwise pattern, everything goes fine. Okay, that's fine. But if things are not going fine, you have to work your way out, right? And then fracture. We have seen candidates saying that the amalgam restoration fractures while I'm carving or while I'm removing the band. Now, please remember to make sure to condense the amalgam really well when you are condensing, and condense in all direction, vertically, horizontally, obliquely, towards the contact point, everywhere condense really well. Make sure to condense as much as possible. I remember when I used to do this task, I used to condense. I never had any problem. This is my favorite task actually. I used to condense so well that the palm it started to hurt, because you don't want your amalgam to fracture later on while removing the band or while you're carving or finishing. You don't want it to fracture, because if it fractures, then you need to do so many things, repeat the restoration, repair it. It's a hassle. So spend ample time condensing so you don't have these problems later on. Now let's assume a situation. You are having a situation where a fracture of the amalgam happens and you don't have any time. Let's say this part fractures, right? Let's assume the cusp position fractures. It's okay. You don't have time. In the existing amalgam restoration that you have in the base, create a hole, mix a new capsule of amalgam, and start condensing. That will work as well. So, like I said, you have to work your way out. The outcome matters, not how you achieved it. Okay. Then, certain times candidates tell me that my cusp position is low. Please make sure that to keep your cusp high, because you can always bring it down. But if your cusp position is low, you cannot increase it, right? So please always keep your cusp position to a high level and then bring it down gradually. Okay. And then we see certain candidates, once they're done restoration, everything seems to be good, but then there are ditches, open spaces between the tooth restorative junction. Now, once you're done with the task, you have scrap amalgam, right? Maybe with you in the cup that you're using to place the scrap amalgam, or maybe within tooth or the gums. Pick up that scrap amalgam, place it in that ditch, and then press it with a ball burnisher. That ditch or gap you have will automatically go away. So you see, these things you need to work your way out. ADC does not know that you have done all these fixing or repair. They don't know. They care about the outcome. Even with 10 repairs, if the outcome is fine, you'll pass the task. So see how you are going to work things out if they're not going in the right direction or in the direction you want it to go. Okay. And just keep practicing. Every time you do this task, practice and see where you're going wrong. And just try to make sure the next time you do the same restoration, you fix that issue that you're having. It's one of the most frustrating tasks. It will give you a lot of nightmares. If it will give you a lot of trouble, a lot of teeth, a lot of amalgam will be wasted, but it's fine. That's a learning phase. Everyone has gone through it. All right. Thank you.